Welcome to Salisbury University on the Air, a program highlighting the activities and the people of the campus. I'm your host, Susan Purnell. The COVID-19 pandemic has highlighted just how important health workers are to our community. Salisbury University's College of Health and Human Services, or CHHS as it's called, prepares the next generation of health services workers, but often that encompasses more than one might think. Joining us to discuss all of the ways the CHHS prepares its students for their next step and works within the community is Dr. Kelly Fiala, Dean of the College of Health and Human Services. Good morning, Kelly.
Good morning.
So good to meet you. Well, we're here to talk about the College of Health and Human Services, which I think was housed in a lot of other schools for a long time. And then finally, with the development of this new college, it's on its own. And what's the advantage?
Yeah, we were housed in the Seidel School of Education and Professional Studies and the Henson School of Science and Technology. But all of these programs came together that are health and human services. And the advantage is the faculty could come together. There's a lot of professional socialization. And what happens with that is they work together on projects, they work together on classes, we've worked together on strategic planning. And that's ultimately benefited the students. So now the students get to come together and have these educational opportunities where they learn about each other's professions and how together we can collectively care for our patients and clients. So it's been a lot of fun.
That's great. I think this past year has shown us proximity is important.
Yes.
Because we've missed it so much.
Yes.
The first thought that comes to most people's minds when they think about the College of Health and Human Services is the nursing program, which is renowned. It's usually among the best in the country, which is pretty remarkable. And this year, some of those nurses had the chance to do something pretty extraordinary, and that's quit early to go work, right?
Yes, so there was a couple of different options. So we worked with the state to identify the skills that the students had at different levels so they could actually work concurrently while finishing their degree requirements. The other thing that we did was accelerate those degree requirements for the students that were seniors. So this was essential to have the faculty involved because nothing was dropped, nothing was compromised, it was all compressed. So they worked together with their faculty to meet their degree requirements early. They technically did not graduate early, but they met those skills and requirements early so they could start performing those in a clinical setting.
But they were still going to school and going to work.
They met their degree requirements a few weeks early so then they could work full time at that point. But yeah, a lot of our students were working all along the way at the level that they were certified for.
But they were so needed.
They were so needed, and they loved the opportunity. Like you mentioned, they wanted to be helping people. They wanted to be serving the community. So
that's great. Of course, doctors and nurses are not the only medical professionals that have made a difference in this past year. What can you tell us about the School of Health Sciences?
Yeah, so this is our school that everybody asks about because it's not as clear, but
I have no idea what it is.
We have 6 programs in that school, and we also have our fitness and wellness component, which is a general education requirement for all SU students. So it's about personal health and wellness. And then with the 6 programs, we have 2 at the graduate level. We have athletic training and applied health physiology, which actually applied health physiology just went through a name change to health and human performance. So we're looking at cardiovascular rehabilitation as well as strength and conditioning with that graduate program. At the undergrad level, we have community health, which also just went through a name change to public health. And that's kind of consistent with the language that you see used in the workforce and in serving the greater public, not just the local community. We have exercise science, which it can result in students doing things with strength and conditioning, fitness and wellness, but also a lot of our students are in pre-professional programs and they'll go on to physical therapy school, physician assistant school, other healthcare programs at the graduate level. And then we have our professional programs that are medical lab science and our respiratory therapy, which again, two really active professions over the last year. So
Right.
always in the spotlight and getting the recognition that they deserve.
Did some of those students leave early to work?
Absolutely. Our respiratory therapy students, it's the only program in the University System of Maryland for respiratory therapy. So they did meet their requirements by the end of April and went out into the workforce right away.
That's just amazing.
It really is. It really is.
You're in charge of a huge area. I'm realizing that. Now, the frontline workers this year have not all been medical personnel, social workers as well. And that's a big program here at SU. Develops professionals that assist in lots of different ways. How have those alumni been key in participating this past year?
Sure. I mean, this past year, certainly mental health has been in the spotlight, and taking care of individuals and groups has been very important to our alum. A lot of our alums do one-on-one therapy with patients, and we've seen huge needs for that in recent times. There's other alums that work for different services, different government agencies that provide advocacy for groups. You know, we've seen a lot also in the news about social justice, and, you know, social work has been leading the charge with that too, and making sure that there's equality and that vulnerable populations have access to having their needs met during these trying times as well.
I never even thought about the need for more social workers and more mental health workers during this. But gosh, I can't imagine people that are vulnerable to begin with, and what the stressors that have been on them this past year.
Yeah,
So,
absolutely.
yeah.
It's definitely a need that many people have experienced over the course of the last year.
Now, social workers support in many different areas: social services, family assistance, child welfare, school intervention, for example. With this broad of a program that you have here, how do students narrow in on the field that they want to become most involved in?
That's a great question. So we really view our curriculum as being a generalist curriculum. So we do try to give them to the exposure to all of those areas. So they're trained in competencies that would make them connect with any of those types of agencies. But the other thing, they are advised by their faculty. They have opportunities to take electives. So they can start honing their skill set in a little bit more and thinking about their specific needs. And then, of course, in their last year, they do field experiences where they're actually placed in an agency, and that tells them a lot about their fit and whether that's going to be the right avenue for them to pursue, or if there's something else that might be a little bit more appealing. So they get that coaching throughout the process.
So, are they all placed in agencies?
Yes.
That are in this, and or internships? Tell me a little bit about these internships.
So for social work, it's their last year. So they meet an hour requirement and they do their competencies. And the great thing about those internships is they're supervised by a preceptor or a field supervisor that is licensed. They get to practice their skills under the supervision, so they can learn on the job. So that transition to practice after they graduate isn't as harsh. They're more adaptable to that because they've had those hands-on.
Real world experience.
Absolutely.
Yeah. Oh, that's really great. Do they do that in a lot of the other colleges, these sorts of internships?
Yeah, absolutely. I mean, the ones you think of primarily, certainly in the College of Health and Human Services, all of our programs require either clinicals, internships, or field experiences. The business school and the Seidel school also require those internships, but we're seeing more and more of these types of experience included in liberal arts and in the sciences too. So students really thrive on those.
I bet they do. I also understand that your social worker program is international. Like, for example, I think you have a Germany, I guess it's a Germany school. Is that right? A German school?
Yeah, we call it one of our satellite programs.
Satellite, okay.
So we have partnered, it used to be at the time, University of Maryland, University College, now University of Maryland Global Campus. But they have a grant through the Department of Defense to serve military personnel and their families stationed in Germany, really Europe, and they have Asia covered as well. So social work was one of those high need areas and the areas of a lot of interest. So we partnered just under 10 years ago with them to start offering our programs. Since we had an accredited program, we've done a lot with our online program as well. So we're able to do asynchronous courses. We also have some partner faculty on site in Germany, and we travel to Germany to offer classes as well. Of course, that's been hindered a little bit in this last year, but we're looking forward to going back and making those connections.
So that's good for the social workers, but how about other students in other aspects of your college? Are they involved in these sorts of placements?
Absolutely. So with our respiratory therapy and nursing and athletic training programs, they're doing clinicals the whole time they're in the professional phase of the program. So those programs have 2 years worth of clinicals. Our medical lab science, community health, exercise science, and social work have those year-long types of clinical or internship experiences.
So you all are out there.
We are out there. We're in hospitals, we're in different agencies, we're in schools, we're everywhere.
That's so great.
Yeah.
So students obviously connect with the community as well during their stay here at SU. And you have the Center now for Healthy Communities as a part of the CHHS, focusing on helping the communities. Tell us a little bit about that.
Yeah, so our Center for Healthy Communities was kind of the second edition of our Child and Adolescent Behavioral Health Initiative, which was housed in the School of Social Work. But with the creation of the college, we wanted to elevate that and also focus on an adult population. So what we've done is created the Center for Healthy Communities. We try to secure federal and state grants to help serve our community, our rural community here in the Salisbury area. So the other thing that we do through the center is offer continuing education to professionals so that they can maintain their certification and licensure requirements. And we do a lot of talks that are hot topics at the time so that people can get some exposure to some content and use that and apply that in real life. So it's a lot of different things. Certainly having the focus on mental health and some other areas of wellness as well as we expand.
Well, I know I've worked with a lot of different nonprofits, Coastal Hospice for a really long time, and one of our hardest things was getting somebody to do grant writing.
Sure.
So is this a situation where, as a nonprofit, I can come to SU and say, hey, we need help, and your students and faculty can participate through this Center for Healthy Community?
Yeah, absolutely. We offer technical assistance for grant writing. We've partnered with community agencies to secure grant funding. So a lot of times that when you're applying for federal money or state money, they want to see those partnerships. They want to know that you have people in your corner making sure that there's going to be successful outcomes affiliated with the service that you're providing through the grant. So people have signed on as our partners, we've signed on as their partners, and we are absolutely willing to offer technical assistance and explore other partnerships to serve the community.
And as you said, in that particular field and in all fields, you never really quit learning.
No.
So your Center for Healthy Communities assists through continuing education programs. Tell me a little bit about those and a couple of examples.
Yeah, sure. We've done continuing education primarily for social work, but we've expanded for nursing, respiratory therapy, and some of our other professional programs. But I would say probably some of the more consistent examples are around child and adolescent behavioral health. We do an annual human trafficking conference. So there's a lot of things to increase awareness and to prepare practitioners to support their clients.
Wow. I don't know how you keep track. You have a dean of a big college, school, and then so many parts within. So you've got a lot of balls in the air most of the time, I think.
Absolutely.
Yeah.
I mean, certainly serving the students is our number one priority as an educational institution, but you can't be a College of Health and Human Services without wanting to support the community. So our Center for a Healthy Community is a real passion of mine and the faculty and staff in the college too.
And I know our community needs it, so thank you very much for that and for all that you do to
you.
help the students and the community.
And thank you for having me. It's a pleasure to talk about the College of Health and Human Services.
I am so impressed with students in the College of Health and Human Services for their dedication to their neighbors and the community at large. Those who graduate from CHHS clearly have hearts of gold. Speaking of graduation, SU recently celebrated its spring commencement with more than 1,500 members of the class of 2021. Graduates and their families took part in the Grad Walk at Seagull Stadium and celebrated all weekend on campus with beautiful weather. Let's take a look.
Congratulations to our graduates. Go out and live your dream. Be the change you wish to see in the world.
Thank you, parents, family, and friends for being there. I hope you all take the time to enjoy the moment. Congratulations, class of 2021.
It's been our honor to have you learn with us. Please stay in touch as you journey on, and I wish you all the very best for the future.
You don't know how much you have meant to us and will continue to mean to us as the years pass. Congratulations to each and every one of you.
Congratulations, class of 2021. We're excited for you and proud of you. Go Gulls!
We are so proud of today's graduates. Congratulations to the class of 2021.
Go Goals! We made it! Congratulations! Go Goals! Congratulations, class of 2021. Best of luck! We did it!
Soar high, my Gulls!
Congratulations! We did it!
We did that thing!
Let's soar high, Salisbury.
Go Purdue graduates!
Congratulations to the Seidel School class of 2021.
Class of 2021, congratulations. You did it. You made it to the finish line. I'm so proud of you.
Congratulations to all the graduates and best of luck in your future endeavors. Make SU proud. I'd like to thank my guest, Dr. Kelly Fiala, Dean of the College of Health and Human Services. I'm Susan Purnell, and this has been Salisbury University on the Air. Thank you for watching.
Congratulations to our graduates. Go out and live your dream. Be the change you wish to see in the world.
Thank you, parents, family, and friends for being there. I hope you all take the time to enjoy the moment. Congratulations, class of 2021.
It's been our honor to have you learn with us. Please stay in touch as you journey on, and I wish you all the very best for the future.
You don't know how much you have meant to us and will continue to mean to us as the years pass. Congratulations to each and every one of you.
Congratulations, class of 2021. We're excited for you and proud of you. Go Gulls!
We are so proud of today's graduates. Congratulations to the class of 2021.
We made it. Congratulations. Go goals. Congratulations, class of 2021. Best of luck.
We did it!
Soar high, my goals.
Congratulations, we did it.
We did that thing.
Let's soar high, Salisbury.
Go Purdue graduates.
Congratulations to the Sidell School class of 2021.
Class of 2021, congratulations. You did it. You made it to the finish line. I'm so proud of you.